Hi, my name is Andrea Cherrington, and I'm a general internist and physician investigator. And I serve as the director of the Division of General Internal Medicine and Population Science in the Heersink School of Medicine at the University of Alabama at Birmingham. And I am also on the executive committee for the CardioHealth Alliance. One of the most important features of the CardioHealth Alliance's work is the imperative to take what we already know works and what we've proven works and translate it for implementation in the real world. As a practicing clinician and an investigator, I so often feel the disconnect between what we figure out in science and what is happening out in real world clinical care. And so, this effort to try to bridge that gap, I think, is one of the most important and, to me, one of the most exciting pieces of the work that the CardioHealth Alliance is doing. For a lot of people in the country, I think going to the doctor really means going to your primary care doctor. Most people, many people, don't have cardiologists, they don't have a nephrologist. And that is particularly the case in a lot of the areas where I live in Alabama, particularly in the rural areas where subspecialty care is really lacking. So if we're going to increase representation of individuals across these rural areas, it's really going to have to start in primary care. There's a lot of interest in involving primary care clinics in clinical trials, I think, from both the investigators' standpoint and also from industry's standpoint. There are some barriers to doing that. Primary care right now in the United States at least faces a lot of challenges in terms of infrastructure and staffing, but I think the willingness to participate is really important. And so I think those are barriers that could be navigated with intentionality and an effort to help provide support for those kinds of activities. One of the aspects of the CardioHealth Alliance that positions it to be successful in the future is the fact that it brings together so many people of differing positions, disciplines, different kinds of stakeholders. So you've got people who are leading scientists in cardiometabolic disease, academic institutions that are heavily invested in this kind of work, industry sponsors and partners who have so much to offer and bring a different perspective to the table. And I think having all of those voices present at the table enhances the likelihood that we'll come up with solutions that are sustainable in the future.